Antigen testing is not the only COVID issue that is swirling around today. There is the digital cert and the possible expansion of the digital cert to other areas and other businesses, other parts of the economy. There's working from home and the likely advice from government after that cabinet meeting tomorrow that all of us should work from home if at all possible. And of course, there is the spectre of the return of restrictions. And all of this isn't because of high case numbers. It's because of the pressure on the hospital system. You would have heard mention of it in the news headlines today. There are 607 patients in hospital with COVID. That number was below 500 this day last week. There's 117 COVID patients in ICU. But in all of the coverage that I've been listening to and reading and watching today, as far as I can tell, two questions are not being asked. The first, is there not a surge capacity that the government have access to? On the 8th of January this year, Stephen Donnelly announced a deal had been signed with the 16 private hospitals in the state, and that deal allowed the government to use 30% of the capacity of those hospitals if COVID cases got out of hand in the public system. Are we using those beds at the moment? It's unclear exactly how many we are using and if we are using them at all in some private hospitals. Surely we need to trigger that deal before we even entertain the idea of imposing restrictions on everybody in society. The other question that needs to be asked, and this is a more difficult question to answer, if we cannot muddle through this winter, and muddle through it will be, if we cannot muddle through this winter without restrictions, is there any reason to believe that next winter or the winter after will be any different? I fear the answer is probably not.